If you aren't currently suffering from sciatica, there's a good chance at some point in your life you will. So let's talk about the necessary steps that you should take today in order to overcome sciatic pain. Hey Wellness Warrior, I'm Dr. Zyrowski, and sciatic pain can be really nasty, and especially if you don't actively pursue fixing it right away, it can be something that can be very difficult to overcome. So whenever you have sciatic pain, you want to make sure you're doing everything you possibly can to make sure you fix the problem so that it's not something that you suffer from for months and months. So what is sciatic pain going to look like? Well, first of all, it's going to be pain that's running down the leg, typically the back of the leg. So it can start in the low back, go into the butt area, and then down the leg. Now the thing is about sciatica is you can have, for one, extreme levels of pain, but you even can have muscle weakness and even some numbness or tingling that's associated with it. Now when we look at the sciatic nerve, it's a nerve that is actually a bundle of nerves, and it comes starting from the low back and then runs down the back of the leg. Now this bundle of nerves is one of the thickest nerves in the body, and it's very important for your overall physical well-being. So if you're having that sciatic pain, that numbness, the tingling, the pain, the excruciating pain possibly that's running down the back of the leg, it's something you really want to think about. Sometimes it just goes to the knee. Sometimes sciatic pain goes all the way to the foot. So what do we do to overcome this problem? Well, what you really want to do is, first of all, think about inflammation, okay? Because typically when you have sciatic pain here, it has some level of inflammation. What I like to turn to is herbal medicine in order to actually help with this issue. So we're thinking of things like turmeric, frankincense, ginger, all the natural anti-inflammatories to help calm this down. I'll put a link in the description to a herbal non-inflammatory that won't be hard on your liver and kidneys like the medications are. So I always like to stick to a natural anti-inflammatory. So we want to focus on inflammation. The next thing that is really beneficial to do here is get chiropractic care. The reason for this is because this issue is likely stemming from disc degeneration, spinal stenosis, some sort of spinal issue. So your low back is having an issue, and that's where this issue is coming from. A lot of times people think, oh, my leg's got a problem. No, it's typically not your leg, it's your low back, which is causing a referred pain down the leg. Chiropractic care works really well because you can get your pelvis properly aligned and also take some of the pressure off those discs that are in your lumbar spine right down in here, which very well could be causing this. The next thing we want to do is we can do a posterior leg massage. So if you're somebody who gets massages, or maybe somebody can massage your leg within your own home, what you want to do is work the posterior aspect of the opposite leg that is causing pain. So for instance, if your left leg has a lot of sciatic pain, you want to do a posterior massage on the right leg. You want to start in the glutes and work down all the posterior aspects of that leg, and then also work on doing some stretches as well, okay? A few stretches I like to do is, for one, child pose. It can really help release that low back and take some pressure off of it so that we can get some pressure off the sciatic nerve. Another thing that we can do is a quad stretch. That can be very helpful, okay? And typically, if we're doing quad stretches, we want to do not only the leg that's affected, but also the opposite leg as well. We want to really try to loosen up that entire lower body to help take pressure off the low back and the pelvic area, which is going to in turn help with that sciatic nerve pain. So we can do a nice quad stretch. The next stretch I like to do is going to be knee to chest, okay? So if you're laying on your back, you're gonna pull your knee into your chest, do both sides. That is also very helpful. And then also what we wanna do as a preventative measure is we wanna work on strengthening our core, okay? So you wanna start doing some core exercises, especially if you're someone who's suffering with sciatic pain right now. You wanna start very light, and I like to start with doing some plank holds or maybe some side plank. And the reason that it's very important to work on strengthening your core at this time, and also to avoid future affliction, is because if you have a strong core, you're less likely to have low back issues which are causing sciatic pain. Okay, so if we kind of put this all together, the first thing we want to do lower inflammation, seek out professional care, and then from there start doing some home therapies in order to help with this issue. And you can of course start with the home therapies first and see if you can get relief with that, because this may be something that you can get some quick relief with if you just start doing some stretches. So I always recommend starting with these home therapies. So work on doing some of the stretches and then also strengthen your core, because a strong core means a strong low back. A weak core means a weak low back. And if you're somebody who isn't exercising and you're spending a lot of time at a desk and maybe your job requires you to be at a desk all day, there's a good chance that your core is very weak, and that's very hard on your low back, and that's going to really ramp up the sciatic problem. So if you're somebody suffering from this, these are the steps that you can take to start getting relief today. I'm Dr. Zyrowski. Be sure to subscribe, like this video, and also check out this video next.